Hi everybody, I'm Dr. Deed Harrison, President of Chiropractic BioPhysics Technique and Seminars, and also President of Chiropractic BioPhysics Nonprofit Research. I've taken a few weeks off here just because I had some business to attend to. Many people have been sending me messages saying I need to restart the videos of the week, and here we are doing this. Really quick, I want to make a new announcement. If you've been following these videos, you're aware I always give a little introduction. This time I want to show off the new CBP nonprofit research website, and it's shown here, cbpnonprofit.com. If we click on that, you'll see that we've just recently launched our brand new nonprofit research website. Shown on this website are the CBP nonprofit research publications. If you go to the appropriate tab, our CBP nonprofit mission statement, our CBP nonprofit board members, and then information on how you can help support and fund chiropractic research with corrective chiropractic care and CBP technique. Without further ado, we're going to go to this week's CBP nonprofit research publication. This one is a great one. It is a game changer. This one was put out by none other than Professor Ibrahim Mustafa from Cairo University. CBP researchers were not a part of this project, which is actually a great thing. This is an independently done project, but CBP nonprofit did sponsor and support this work through the dental rolls. Okay, and also we've done some collaborative work with Cairo University and Professor Ibrahim in the past. So this is really the first publication that we see that's in print on the cervical dental roll and restoration of the cervical lordosis and how that impacts or may impact human health and disease conditions. In this case, we're talking about fibromyalgia. Now, fibromyalgia is a big issue. This is a syndrome, a collection of different disorders that are affecting an individual. These people have a lot of pain, a lot of anxiety, a lot of depression, etc. There's really no serious long-term hope for people that truly are sufferers with chronic fibromyalgia. So this is a very important project. Okay, this is from the Bulletin of the Faculty of Physical Therapy from Cairo University, Volume 18, Number 2, 2013. The title is, "Does Improvement Towards a Normal Cervical Configuration Aid in the Management of Fibromyalgia, a Randomized Controlled Trial?" This will have a 1-year follow-up. This was done by Professor Ibrahim Mustafa from the Basic Science Department of the Faculty of Physical Therapy at Cairo University in Egypt. Okay, so when we see fibromyalgia, we see this collection of really bad pain processing issues in these patient populations. Classically, it's characterized by widespread musculoskeletal pain. These people usually have sleep disorders, moodiness, memory disorders, etc. Classically, fibromyalgia afflicts and affects women at a greater rate than it does men, but the men also suffer with this as well. And classically, it tends to be in the older adult population. Typically, it's anywhere from 30 years of age and up. However, we see the incidence of it rise as we get a little bit older. Okay, so the issue is these people have what's called widespread pain syndrome. So we know that there is a centralized processing problem with pain. Of interest, these people also can have headaches, jaw problems, and obviously anxiety, bowel disorders, and depression disorders. Now, classically of interest, oftentimes there is a traumatic trigger for the onset of fibromyalgia. So usually there's some type of musculoskeletal trauma. It can also be an infection or some kind of major surgical intervention that sets this off. Now, in other cases though, there may not be an exact trigger or a mechanism of injury. However, in most of the cases, there tends to be a trigger. And this may be important for us to understand a musculoskeletal or a postural part of this scenario. Maybe there is a trigger for it that is a spine injury. Okay, the reality of it is there's no true cure for this that's been reported in the literature. Now, there are medications that help. There are exercise regimens that help, stress relaxation techniques help, cognitive behavior therapies help, but the long-term prognosis of fibromyalgia tends to not to be so great. This particular project thus takes on this great task, if you will, of looking at, can we find an interesting solution for a subgroup of fibromyalgia sufferers. So this was the purpose of this project done at Cairo University. It's a randomized trial with a 1-year follow-up. There are 22 females and 58 males aged 40 to 65 years of age. Now this seems counterintuitive when you look at fibromyalgia affecting women greater than men. However, when you do a randomized trial, you never know exactly what you're going to get. So realize that while right now in this project there's a greater number of males than females, you still have to realize, hey, this is just the way the scenario unfolded. Okay, so 80 total subjects. They're going to be randomly allocated into one of two groups: a control group that gets some standard care, and an experimental group that gets standard care plus the cervical dental to rehabilitate the cervical lordosis and forward head translation. Now, proper sample size statistics were performed. What was looked at here is they needed a 15 to 20% change on the main questionnaire used, which is the Fibromyalgia Impact Questionnaire. So looking at a 15 to 20% difference or change in the FIQ, we needed a sample size of 25 subjects in each group at the end of the study. And you notice I say we. I always include myself in these projects because I do want to be involved, so forgive that. Okay. Also, the American College of Fibromyalgia criteria was utilized to select these subjects to go into the population that was being tested. Every subject had to have a hypocervical lordosis, so loss of the cervical curve, with forward head translation. I'll tell you exactly what that means. So this is our subgroup. We have a subgroup of fibromyalgia sufferers. This subgroup has to have forward head translation of a specified magnitude and loss of the cervical lordosis. They have to be chronic in nature. Also, inclusion criteria to be more specific. Loss of the cervical curve was defined as 25 degrees or less of the cervical lordosis from C2 to C7. So you had to have a straight cervical spine or a kyphotic cervical spine. You had to have anterior head translation of more than 15 millimeters. Most subjects had well more above that, okay, well above that 15 millimeter mark. Also, again, we used the American College of Fibromyalgia criteria to select these subjects. These subjects had to be suffering for 4 years or more with chronic fibromyalgia symptoms and types of disorders. And then they were aged 40 to 65 years. Also, they had to score on the Fibromyalgia Impact Questionnaire a score of 59 points or up. Okay, so this is important. We have a cut point to look at actual sufferers with what you'd call moderate to severe fibromyalgia syndrome. They also had to be able to read English, as these questionnaires are in English. Exclusion criteria. Always projects have exclusion criteria. For example, if subjects had a cervical curve above 25 degrees, then they're not in the study. If their head translation is less than 15 millimeters, they're not in the study. If they have a history of stroke, they're not in the study. If they have a history of cardiopulmonary disorders, they're not in the study. If they have a history of other diseases like polio, multiple sclerosis, lupus, things like this, they're not in the study. Also, neck and back surgery subjects that have had this previously are not in the study. And then people that have true psychiatric disorders were excluded from the population, as these may have affected the outcomes and their compliance with the treatment program. Okay, so initially 150 subjects were screened for fibromyalgia, And then of those, several of these subjects were not eligible. Okay, so they are excluded for different reasons, including some subjects just refuse. And then we're left with 80 subjects that agree to participate. These 80 subjects are randomly assigned with a random allocation process to one of two groups. The control group is 40 subjects who get standard care. We'll talk about that. They're going to be treated 3 times a week for 10 weeks, and then they're going to have a repeat measure of the examination procedures done at the beginning of the study. They're going to do that following their 30th visit. Now, not immediately afterwards. They're going to wait at least 1 to 3 days after their last treatment session before they get a re-examination. Then care is stopped after that re-examination. So they get 30 sessions, re-examination, care is stopped, terminated, and then we follow the subjects for another year. So 1 year later, 7 of the 40 subjects are lost to follow-up for non-medical causes, and then 1 subject is lost for a lower limb fracture. So there's 8 subjects that didn't make the 1 year follow-up in the control group. That means 32 subjects made it. That's great. We need 25 subjects in this for proper power analysis for statistical analysis between the groups. The experimental group, they're going to get standard interventions just like the control group, but then they're going to get the Denerol as well 3 times a week for 10 weeks or 30 sessions in the outpatient hospital setting. So it's supervised intervention, including the Denerol, supervised. So the experimental is the Denerol group. They're going to get 30 visits 3 times a week, 10 weeks, just like the control group. At the end of 30 visits, 10 weeks later, they're also going to do a follow-up examination and an x-ray. We're going to see, did this treatment affect their cervical curve and posture as well as the fibromyalgia outcomes? We're going to reevaluate them after 1 to 3 days after their last treatment session. Then they're going to stop care, totally stop care with the Denerol, and then they're going to look at long-term follow-up at 1 year. Now, 1 year later, 12 of the subjects are lost, 12 for non-medical reasons. Okay? Now, what that means is 28 subjects were left at the 1 year follow-up. This is good. This is above my 25 subject mark. So we can look at this and go, happy day. We've got a minimum of 25 subjects at 1 year follow-up in each group. This is why Ibrahim, what he did was he increased the sample size needed to 40 subjects because there is a risk of subjects dropping out at the 1 year follow-up. Great job. Now, patient demographics, I'll just quickly let you look at this. What this is for is to look at the subjects in each group. Are they compatible and comparable? Is their age, is their sex, is their height, weight, occupation, what do they do? Are these things comparable? You look at this so we know we're working with groups that are evenly matched or nearly identical. Okay, treatment methods. Both groups get what's called an education program. This education program helps address some of the psychosocial needs that fibromyalgia sufferers are dealing with. Okay, it helps address this disorder. So it helps set the stage for the program. It's kind of like a cognitive behavior intervention, but not really. It's just educating them on what the condition is, things that they can do that might help, things like that. Okay, this was done once a week, approximately a 2-hour education program once a week for 10 weeks, so 10 sessions. Then there was a true behavior therapy, a CBT part of the program. This was a 2-hour, one type a week setting where a clinical psychologist sat down with the subjects and went through a proper, cognitive behavior therapy intervention. This is important because this has been shown to help people with fibromyalgia, help them improve, number one, their mood, their depression, their anxiety, but also help them, try to achieve a more active lifestyle by addressing, basically, again, the psychosocial and emotional components of this disorder. So once a week for 10 weeks. And then there was a functional exercise protocol following standard interventions that are used for fibromyalgia. This was done 1 hour 3 times a week for 10 weeks. There was 30 sessions of this, okay? Now, both groups got these 3 things. The Deneral group got that just like the control group did. So they got the same 3 interventions there. The difference is the Deneral group also gets the cervical Deneral 3 times a week for 10 weeks or 30 sessions. We'll talk about that. Treatments were applied in a therapy room 3 times a week for 10 weeks, 30 sessions. Now the Deneral is designed to help improve the cervical lordosis. It's what we call a passive 3-point bending orthotic. The peak of this Deneral is placed at the apex of the abnormal cervical curve. So number 1, we have to have a cervical x-ray to identify if a candidate is, or if a subject is a candidate for the Deneral. That's number 1. We have to have an x-ray. Number 2, we have to analyze the x-ray to see where should the peak of the Deneral be placed. Now realize the Deneral is a patented product that has a unique shape that's designed to improve the cervical lordosis. Okay, so this is a patented product, and it is not a pillow. The Deneral is not a pillow that you buy at a store and you lie on. Okay, this is a very specific orthotic for the cervical curve, and it helps rehabilitate the shape of the cervical curve. There are inclusion and exclusion criteria for the Deneral. So the public, the consumer, unfortunately, you cannot just go buy a Deneral at a store. That is not appropriate. You don't know if you're a candidate for it. You have to be screened by a healthcare provider who is going to determine whether or not you're a candidate for it. You have to have an x-ray. That x-ray has to be interpreted by somebody that knows what they're doing, aka a doctor, and then also, they have to select where you're going to place this Deneral. And by doctor, I mean a chiropractor, a medical doctor, etc. Somebody that's trained in spine radiography and trained to understand the risks and the benefits of this tool. Okay, so with that being said, the subjects in this project were adults, so they either got the large gray device or the mid-size white device based on the size and the flexibility of the neck. Professor Ibrahim selected the candidates for number 1, what size they're getting and the location in the neck. Now, the Deneral application starts with 1 to 3 minutes per session. So session number 1, you're on it for 1 to 3 minutes, and then the subject is progressed over consecutive sessions to where they can do 15 to 20 minutes of sustained Deneral cervical traction at a time. Okay, so you start with 1 to 3 minutes and then you progress up to 20 minutes maximum on the Deneral. Okay, now you'll see most of the subjects got it in the lower neck. Why? Well, that's because their lower neck was mostly the area that started the abnormality, like a straightening or a kyphosis, means a reversal, and the subject had forward head translation. None of the subjects got the Deneral in the upper neck. 10 or roughly 25% got the Deneral in the mid-neck. Most of the subjects were lower neck placements. Outcome measures. There's several in this project. What an amazing project. We have spine x-rays for forward head translation and cervical lordosis, C2 to C7. Also, what was done was a 3-dimensional thoracolumbar pelvic postural analysis in the sagittal plane as well as coronal and transverse planes. Okay, this was done using the Fermetric system, so raster stereographic postural analysis using a Fermetric system. Okay, it's patient-specific outcomes for fibromyalgia. Now let me stop just for a minute. The first 3 are what we call doctor-relevant outcomes, doctor-driven outcomes. The doctor cares about, or the provider cares about, your posture and your x-ray. Now, it's not that the patient doesn't. However, these are what we call the structural-based outcomes. We don't know if these outcomes are going to affect what we call the functional or the fibromyalgia patient-relevant outcomes. What's a patient-relevant outcome? Well, how much disability, how much pain, how is this condition affecting your health status? This is the fibromyalgia patient-specific outcome questionnaires. This is the very important part of the project. We're going to separate these these out and see what the relevance is between these outcome measurements of what we call the doctor-driven outcomes and then the patient-driven outcomes. The Fibromyalgia Impact Questionnaire. This is the primary outcome questionnaire used, the FIQ. Now, remember, people had greater than a 59-point score on this, meaning they're moderate to severe. The higher you score, the worse you are. So the FIQ, we need at least a 15 to 20% reduction in this to see, did our methods have an impact? And we also need 15 to 20% change between the two groups to see, are there group differences? And then pain catastrophizing scale, the PCS. Pressure algometry. At what pressure does it elicit pain in you? We know that pain sensitivity is reduced in subjects with fibromyalgia. So slight pressure causes a lot of pain. There's a central processing problem with pain and fibromyalgia. So we want to record that. How many kilograms, per cubic centimeter of pressure can I push before I get a pain, response in somebody? So if this is very low, it means they have a lot of pain. If it's very high, it means, hey, I'm actually improving fibromyalgia pain sensitivity, right? Or pain processing. And then the sleep quality questionnaire, the PSQ-I-10. Fatigue, using what's called the MFI. This looks at general physical, mental, motivation, activity, etc. And then a general health questionnaire, GHQ-20. And then also an anxiety and a depression inventory called the Beck. This looks at anxiety versus depression and fibromyalgia. So a whole host of questionnaires were used. This is very important. And these were all the exam procedures and outcome measures were assessed at 3 intervals. Baseline means initial study. 10-week follow-up after care, 30 sessions after that. Okay, and then 1 year later, 1 year after the 10-week outcome. Results. This is important. I've separated it out. Look at the top. At 10 weeks, there was no difference in the two groups or between the two groups in what we call the fibromyalgia relevant outcomes, meaning their pain, their disability, their health, the FIQ, all that showed improvement in both groups. So both groups got better compared to their initial versus the 10 weeks of treatment. So both groups got better, but there was no between group differences. Okay, this is the important part at 10 weeks. Both groups are better, but the two groups are equally as good. Okay? So both groups, you would say, if this is you, if you're one of these participants, you're like, hey, I'm better, right? I feel better than I was at the baseline. But if you're in the Deneral group, you would go, well, wow, I'm no different than the people in the non-Deneral group, okay? This is one finding at 10 weeks. Hold on. Okay, now, so we know that the patient-relevant outcomes are the same between both groups, but they are better than when they first started. The study versus the control group at 10 weeks, this is what we call the doctor-driven outcome. Look at this. The postural measurements using the 3D formetric system are better in the Deneral group. Statistically significant differences favoring the Deneral group. That means their posture is better in 3 dimensions. They stand straighter, both from the front and from the side. They're better, okay? So Deneral has an effect on the posture. Quite interesting. The anterior head translation in both groups was significantly better than it was at initial baseline. However, it was greater improved in the Deneral group. The Deneral group got 13.4 millimeters of improvement in the head translation from initial to 10 weeks of treatment. That's pretty good, just over a ½ inch. So the Deneral group has more improvement in head posture. Okay, although the non-Deneral group also improved their posture significantly. Here's the big one for doctors. Cervical lordosis was improved in the Deneral group, and it was not improved in the other group. Okay, so the cervical curve is 12.8 degrees, almost 13 degrees improved in the group that gets the Deneral. So 30 sessions on the Deneral improves your cervical curve by 13 degrees. So the Deneral group is seeing what we call positive structural outcome measurements. So the cervical curve is improved, the head posture is improved, and the 3D posture of the body is improved. However, at 10 weeks, it didn't make a difference to the fibromyalgia patient-relevant outcomes. So at first, you might be disappointed in this as a chiropractor or a doctor providing intervention to a patient. Or maybe you're disappointed in this as a patient because you went through an extra treatment that the other group didn't, and it didn't make a difference in how you feel. However, stop. Let me stop you right there. 10 weeks of treatment is going to make you feel better on average. No matter what you do, typically a 10 to 12 week program, you're going to feel some benefit because you're moving, you're exercising, you're going through counseling, behavior modification. You're doing things that drive improvement of this disorder and this condition. So you don't know yet how you're going to feel after you stop that. That's probably the most important thing. What happens when we stop care? If there's a difference at 1 year follow-up, now we can go, wow, this treatment actually did something, right? It's kind of like taking a drug. When you're on the drug, guess what? You feel different. Obviously, it changes your biochemistry and your processing. So you feel different, but you know what? When that drug wears off, guess what happens? It typically probably didn't solve the actual problem, right? So, there is an underlying reason for you to have this thing. And oftentimes pain medications cover it up. Well, you could look at this like that. The treatment that is being done is masking the disorder so people feel better. That's great at 10 weeks, but we truly don't know what's going to happen when we stop. So then now that's said, let's look at the 1 year follow-up. 1 year later, after stopping care, both groups, here's what was found. There are now significant differences between the groups for all the variables. What does that mean? It means the control subjects that did not get the Deneral, their pain and disability, psychosocial, emotional, and health disorders start to go bad again. Their problem starts to come back. I'm going to show you in a table that was presented in this project where all the outcomes were tracked. Okay? The Deneral group continues to improve on many of the outcomes. This is really important. This is the impact of the study. 1 year after stopping care, now that I have a better cervical curve and my head posture is improved, now I can see what happens to my body over time. My body is healing up. It's starting to like having better posture and a better cervical curve, and I continue to improve with fibromyalgia. This is what was found in this project. This is the impact of this project. Wow, what a deal. Congratulations, Professor Mustafa. This is an amazing project. Check it out. This is the postural changes over time. SR means surface rotation, LL lumbar lordosis, TK thoracic kyphosis, TIN means trunk inclination in the sagittal plane. And then we have trunk imbalance. You could look at that as like coronal plane side shifting or offset. Okay? And then AHT is anterior head translation, and ARA is the cervical curve C2 to C7 on X-ray. Now, if you track these things, the posture is improving greater in the Deneral group. That's the E group. E is experimental, C is control. Okay, this is baseline, this is 10 weeks, this is 1 year follow-up. Okay, now of course, we found, or what was found, I always try to include myself, as I'm doing this video, what was identified is that these subjects are improved in their posture in the Deneral group as compared to the non-Deneral group. And these things are mostly maintained at long-term follow-up, okay? So the posture is mostly maintained at long-term follow-up. This showed it didn't continue to improve in the non-Deneral, or excuse me, in the Deneral group. Their posture did not continue to improve after they stopped care. Now that makes sense, right? Because they're not doing anything anymore. But what is shown is these numbers are showing maintenance. So if you look at where the arrow is here, we're maintaining the improvement. We're better than we were at baseline, than at 10 or compared to 10 weeks, and then 1 year follow-up, we're better than at baseline. So we've shown maintenance here, The non-Deneral group did not get these profound postural changes. The only one that changed was the anterior head translation. The control group went from 27 down to 19. You would say that's an important change. However, if you look, the Deneral group went from 28 down to 14, and theirs is maintained at 1 year follow-up, where the control group goes back to almost, starting to creep back to baseline values. So now we see big differences between the groups. Here's the cervical curve. In the experimental Deneral group, 6 to 19, that's a 13-degree change. And then at long-term follow-up, they only lose a degree of that correction. It's still corrected by 12 degrees. Here's the non-Deneral group, the group that only got the 3 interventions. 7 degrees to 7 degrees, 5.5. Look, they're losing a little bit of their curve. The natural history of the cervical curve tends to be you lose a little bit more of it over time. The Deneral is showing changing that natural history. We've got a better curve in the Deneral group. Now here's the important part. The important part is the fibromyalgia patient-relevant outcomes. Let's look at this. The FIQ. This is the important questionnaire that the sample size was based on. Needed 25 subjects to get a 15 to 20% statistically significant difference in this questionnaire. Now look at the E group is the Deneral group. 70. Control group is 71. Those two groups are identical within 0.4 points on that. So there's no difference. Now both groups improve by more than 15 to 20%. They go from 70 to 44 in the Deneral group and 71 to 43 in the non-Deneral group. Both groups are improved. No statistically significant differences between the group at the 10-week mark. However, look at the 1 year follow-up. The Deneral group goes down to 9.3. Wow! That's huge! That's a big change, right? Continued to show improvement on this important fibromyalgia questionnaire. Now look at the non-Deneral group. They're still better, but now they're going back up. They're almost at 50 on this. This is a huge difference between the groups. This is a statistically significant change favoring the Deneral group. Why are they getting better? Well, I'm going to submit to you, your body likes to have a cervical lordosis. It likes it. It's the normal for your curve. It's supposed to be there. If you don't have it, something happened to you. You had some kind of trauma, some kind of accident. You have poor postural habits, whatever it is. You've lost your cervical curve, and people that don't have a cervical curve don't do so well. That's what I see in the literature all the time. That's what this study identified is when you change the cervical curve towards normal, people continue to improve. When you don't, look what happens. The FIQ is starting to slowly creep back to baseline values in the group that didn't get the Deneral. In other words, their curve didn't change. Now look at this. The PCS. Same thing was found. Follow the numbers. I'll just let you look at these. Look at the Deneral group. Continues to improve. The non-Deneral group gets worse. Look at the general health questionnaire. 2.2, 2.1, 18.3, 19.9. Now, there's a little typo here that didn't get caught. The way this questionnaire works is when we look at this, these numbers should be getting bigger. This is actually, 44 in the GHQ here, right? This is not showing the Deneral subjects getting worse. So once in a while there's a little typo. This is what I'm really good at, is finding the typos. If you don't believe me that that's a typo, I challenge you to email the author and you'll find out that I'm correct there. The GHQ, the experimental Deneral group, actually gets better over time. So excuse the typo in that once in a while. Typos get made even in publications, right? I can tell you that as a reviewer for many journals, I catch typos all the time, and once in a while they don't get caught before they're in print. The pressure algometry. Pressure algometry, the lower the number means the worse that they're getting, the lower the number means at lower pressures they're getting a lot more pain. Okay, so I push a little bit and you go, ouch. Okay, so the lower the number, it means you're sensitive to pressure. Okay, now when I look at this, the Deneral group, 140 to 166, 166 to almost 190. That's a big change. The non-Deneral group, 140 to 167, but then look what happens. They drop back down to almost exactly where they were. This is a big thing. This is a very important one. Pain pressure thresholds. If you're dropping back down to where slight pressure causes a lot of pain, your fibromyalgia is not really better. Now look at the Deneral group. The Deneral group, they're continuing to get better. They're continuing to get better. That means their pain pressure sensitivity is starting to improve. That means the central processing mechanisms are improving in this group. This is a big deal for people with fibromyalgia. You know, slight pressures trigger a lot of pain in these people and they don't know why. This study offers some hope in this subgroup of fibromyalgia. And you can go down and look at all these other questionnaires and you look at the pain improvements. These things show that the 1-year follow-up, which is actually more important than the 10-week follow-up, the 1-year outcomes favor the Deneral group, and in my opinion, and in the author's opinion, there's no other explanation to explain this finding than we've restored the cervical curve and the body does better. It starts to heal up. Okay? Let that sink in for just a second. Let me show you an example of what I mean for people out there. This is the type of subject that was in the study. These subjects had forward head translation. This one shows 39 millimeters of forward head translation. This shows a loss of the cervical curve starting down low, a reversal of the cervical curve down low. This is a subject, the Deneral peak would be placed down in the lower neck. This is the 10-week, 30-visit outcomes. Of course, I've selected a very rapid responder to make a point. Obviously, the Deneral group got almost 13 degrees. This one shows a really nice correction. Now, not everybody gets this big of a correction in 30 sessions, but some people do. So look how much better this curve is. And then the 1-year follow-up, look at that. It's maintained its improvement. It's maintained its improvement. The body needs to have a cervical lordosis to heal. That's always been a perspective in chiropractic biophysics. Your body needs to have a cervical curve to heal. It is normal anatomy. Normal anatomy dictates normal function. It dictates normal brain activity and central processing. It dictates spine movement patterns, things like this. In this project, what was found was that losing your cervical curve, the long-term consequences in fibromyalgia may be that you don't do so good. Short-term outcomes, you can improve short-term outcomes of fibromyalgia by doing a multimodal approach, behavioral therapy, cognitive behavioral therapy, a functional exercise regimen, and then educating yourself on the actual condition itself and learning how to cope and manage this. However, if you stop doing those things, the condition may actually come back again. And notice that the Deneral subjects, while they're not cured of fibromyalgia, they're doing a heck of a lot better at 1 year. This is a very important piece to the fibromyalgia puzzle in this subgroup that had loss of the curve and forward head translation. So just to summarize, which I just did, but I'm going to do it again. The cervical lordosis was improved after 10 weeks of supervised Deneral use. Not just doing it on your own, okay? Supervised, okay? By the treating physical therapist in this project at Cairo University. The Deneral improved the curve by 13 degrees after 30 sessions. Anterior head translation was improved in both groups, but more so in the Deneral group by just over half an inch. Fibromyalgia outcomes, the FIQ, PCS, algometry, pressure scores, PSQI, sleep, the MFI, general health questionnaire, and then anxiety and depression scores and pain were improved in both groups at 10 weeks. This is great for people with fibromyalgia. They improved at 10 weeks. Both groups improved the same. However, only the Deneral group at 1 year follow-up, continued to improve and improved to a great extent. This study shows that restoration of the cervical curve with the Deneral may be an important piece to improving fibromyalgia outcome measurements. It improves the cervical curve, which improves the chronic long-term pain, disability, depression, anxiety, and general health with fibromyalgia. This is a very important project, very important. Thank you to Cairo University, their physical therapy department. Thank you to Professor Mustafa for this amazing research project. And I'm honored to be able to present this on behalf of CBP nonprofit and hopefully on behalf of Professor Ibrahim Mustafa. So hats off to you. What a great project. And also just a quick acknowledgement to the designer of the dental. Dr. Adrian Denewald in Sydney, Australia designed this dental. This is an amazing tool. This is one of the first independent evaluations of the dental. Dr. Adrian did not fund this project. He did not participate in the project. This is a truly independently done project that actually has validated the dental for improving the cervical lordosis and improving head translation in this subgroup of patients with fibromyalgia that have loss of the cervical curve and forward head translation. What a great research project this was. Hopefully you enjoyed it. And as I stumbled my way through it, it wasn't really my project, so I had to read a few things here and there, but hopefully it was an important project for you to have listened to. And if you're out there, if you know anybody with fibromyalgia, let's get them properly checked. You can find a chiropractic biophysics trained chiropractor by going to cbppatient.com. Okay? Let's see if there's something we can do to help these people with this chronic condition that oftentimes there is no hope for. Until next time, I'm Dr. Deed Harrison. Thank you for your time and attention.